Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the respiratory disorders. Pulmonary edema, medical emergency, abnormal accumulations of the fluid in the lungs, causes the LV failure, rapid administration of IVF, clinical manifestations, increasing the respiratory distress, dyspnea, air hunger, anorexia, agitated confusion, cough, frothy pink sputums, crackless trails, tachycardia, jugular vein distension. Diagnostic findings: chest X-ray show the increased intestinal marking, ABG show the increasing hypoxia, BNP elevated. Medical management goal: correct underlying the disorder, medications, oxygen, endotracheal intubations, morphine, diuretics, vasodilators, dobutamine, milrinone, and digoxin, nas- nasritide, hemodynamic monitoring, arterial line, central venous pressure, Swan gauge monitoring. Nursing management assist with the intubations if necessary, monitor the mechanical ventilation, administer the oxygen by masking, HOB elevated legs, the dangling of, if possible, administering and monitoring medications, provide the psychological support, CVP, hemodynamic monitoring, vital sign frequently, nursing management, the low sodium diet, fluid restrictions, strict I and OS, daily weight, home care. Adult respiratory distress syndrome, also called the ARDS, characterized by the sudden progressive pulmonary edema, increasing the bilateral income rates, hypoxemia, regardless to oxygen therapy, decreased lung compliance. Next is the pathophysiology, result of inflammatory triggers that the damage, collapse the alveolar intestinal spaces, direct injury to lungs, trauma, smoke inhalations, aspiration infections, DIC, indirect shock, major surgery. Clinical manifestations, severe dyspnea occurring 12 to 48 hours in insult, arterial hypoxemia regardless of two amount lung are the stiff. Assessment findings, diagnostic findings, medical management identify and treat the underlying causes, intubations, mechanical ventilations. We'll see the PEP goal. There are the hemodynamic monitoring, maximum recommended interleukin 1 receptor antagonist, neutrophil inhibitors, surfactants, pulmonary vasodilator, corticosteroids. Nutritional supports are the 30 to 35 to 45 kcal per day. Next is nursing management. Monitor and implement the medical plan of care, patient positioning, psychological support, ventilator considerations, do not turn off alarm, hypotension, fighting the ventilator, suction frequently, bite block, sedations, neuromuscular blockages. So in the today class, I discuss about the following disease, their pathogenicity, their management. Thank you for watching.